here today we have Samaritan Medical Center Chief Medical Officer, Dr. Mario Victoria, here to answer questions about COVID-19 in the North Country. Thank you so much for joining us today. I really appreciate it. So I'm just going to start off by talking about or asking you a question about a hot topic that has come about in the past couple weeks. 3 companies have announced the potential for a COVID-19 vaccine, and the U.S. is expecting to move forward with it. So what are some things that Samaritan or similar healthcare systems here in the North Country would need in order to both house the vaccine and distribute it to the public?
Okay. Well, first we need to be ready for that whenever that time comes. We can't really make plans in a vacuum. New York State has a vaccination program to ensure that every New York State resident receives the vaccine if they wish to get it. And they are the ones writing the guidelines, and we need to follow those. They are also waiting for CDC recommendations and guidance. The feds are the ones that are going to decide when the vaccine is going to be available and how many doses each state is going to get and how is that going to be distributed. And the main decisions are going to be at the federal level. And then the state will have to decide how we do that within the state. They may choose to allocate the vaccine first in places that have a higher incidence of COVID. That could be in New York City, for example. And in places that are not as bad, may have to wait a little bit before they get any vaccines themselves. But there are a couple of things that we do know. We know that, as you mentioned, there are 3 vaccines that seem to be closer to approval. The 2 first ones, Pfizer and Moderna, those are 2 doses vaccine. So they require 2 shots to give you the immunity you're looking for. And they are not interchangeable, meaning that you cannot mix and match. So if you get the first dose of Pfizer, the second one has to be Pfizer as well. And so you have to keep very tight controls. You have to make sure that you know which one every person receives so they can get the second one. And also you have to make sure that once you give someone the first dose, you have enough to give them the second. Because if you don't, then you have accomplished nothing. So those are the things that you have to be very careful with. Also, some of these vaccines have very tight requirements in terms of storage and transportation. Some of them require temperatures between -60 and -80 Celsius. That is very cold. Those are special lab freezers. We don't have that. We don't use those freezers. We don't need them until now. So we had to go and buy them and acquire that technology so we could have it here. Be ready for that time when the vaccine comes. So those are the things we have done. We also know that the vaccine is going to be limited. The supply is going to be limited for some time, right? The government has purchased a number of doses, but that's not enough for everyone. So eventually, every person that wishes to be vaccinated will be able to do that, but that would take several months, many months, perhaps close to a year. And the CDC has come up with guidelines about that. And higher risk groups will be immunized first. So it's not like if the vaccine gets approved on Monday that you can call your doctor's office on Tuesday to go and get immunized. That's not going to happen.
So my second question is, after we talked about the vaccine, so right now, we're seeing an uptick of COVID-19 cases in the North Country and really all over the state. So, we have these state classifications of cluster zones. Right now, we're not in one. But if the North Country were to become a New York State classified cluster zone, would the quantities of available COVID-19 tests be enough to perform mandatory testing for businesses, schools, etc.? Or would the North Country need more testing kits or testing availability?
We will probably. It all depends on how bad it gets. It is true that we are seeing a surge. we have more cases, more people are testing positive. And the resources we have are limited. We did come up with a surge plan back in the spring when COVID started. We have tweaked that plan as we learn more about the disease. And we are ready to implement and expand that plan when the time comes. We really hope that that time doesn't come, but it seems to be getting closer as we speak. So we will see what happens.
So off of that, what are your concerns regarding a potential rapid increase in COVID patients needing care at Samaritan or other smaller healthcare facilities in the North Country? Are you concerned possibly about hospitals being at capacity to care for patients or COVID patients in general?
Yes, we are concerned about that. It is a possibility that it's present in our minds. If we get to a point when we see a surge, we may have to limit other services we provide. We may have to cancel elective surgeries. We may have to do things that we did already in the spring to respond to that surge. My hope is that that surge will not overwhelm our resources, because as I said before, they are not limitless. So that's where we are.
Understandable. Considering, a possible surge, what are other concerns that you have at Samaritan or just in the community in general as COVID cases are rising?
Well, a couple of things. I don't think everyone is concerned enough about COVID. And I think some people have gotten used to the idea that COVID is here. And it's true that it's part of our reality now, but it is a deadly disease, potentially deadly disease. And it's something that you certainly don't want to catch. Most people get better, but some people don't. And I think keeping social distancing and using your mask and being careful and avoid traveling, as we were saying before, are things that everyone should have in mind. Even when the vaccine comes available, those measures will have to continue for some time, because to stop COVID, you will need most of the population immune. And as we said before, that's going to take probably closer to a year. So this mask and social distancing is not going away anytime soon. It doesn't look like that. So that's a concern. Something else is that if you haven't gotten your flu shot, you should get it. You don't want to get those two diseases. You could do that, and that wouldn't be a good thing. There's still flu vaccine out there. It's available. We haven't had any shortages yet. So if you haven't gotten one, just please go and get your flu shot.
My final question for you is, if you could say one thing to the North Country right now about COVID, as we're heading into the holiday season, it's getting colder, what would you say to the general public?
I think the most important point to get across now, today, is please follow social distancing guidelines. That's the only way you have to protect yourself at this point. Use your mask. Try not to travel if you don't have to. Limit the amount of people you see, because that's the only way you can limit your exposure. And exposure could happen everywhere. We have enough COVID cases in the community now that you could be exposed everywhere. Jefferson County just announced today that they were not going to be calling anybody for potential exposures, because there is enough in the community that you should assume that everywhere you go, you could be exposed to COVID. So social distancing, mask, get the influenza vaccine if you can, and we are here for the long term. This is not going to go away anytime soon.